Consent refers to giving permission or agreeing for something to happen. In medicine, this is commonly giving permission for an examination, investigation, or treatment. The term informed consent means that the patient gives permission with full understanding of what is proposed and full knowledge of all the risks and benefits. In the PLAB2 exam, you may be expected to gain consent from a patient for a treatment or investigation. There are specific GMC requirements relating to patient consent that you should be aware of and demonstrate in the exam. The GMC highlight that for patients to consent, there must be a doctor-patient partnership based on openness, trust, and good communication. The GMC highlight that both the doctor and the patient have a role in decision-making and consent. As part of the doctor's role, you must listen, respect patients' views, and discuss what their care involves. You must provide information that the patient wants and needs, and maximize opportunities for patients to make decisions. Lastly, you must ensure you respect patients' decisions. The GMC provides a framework to support patient decision-making and allow them to give informed consent. You should use this framework when consenting patients in the PLAB2 exam. Begin by assessing the patient's condition, taking into account the history and the patient's views, experience, and knowledge. Next, you should use your own specialist knowledge, experience, and clinical judgment, along with the patient's views and understanding, to identify the investigation or treatment of most benefit. You should then explain all risks, benefits, burdens, and side effects of each treatment or investigation, including the no treatment or investigation option. As the doctor, you are allowed to recommend an option, but you should not pressure the patient to accept this. Support your patient, answer their questions, and provide enough time for them to weigh up the various options and decide which, if any, they will accept. Patients have the right to accept or refuse treatment. If your patient chooses treatment which you believe is not of overall benefit to them, you must explore the reason why they have made this decision. In the exam, you may face a scenario where a patient is asking for treatment that you do not feel is an overall benefit to them. In this scenario, you do not have to provide treatment that you think is not of overall benefit to the patient. However, you must explain your reasons and all other options, including the option for a second opinion from another medical professional. There may be scenarios where you feel patients are making decisions without the appropriate mental capacity to do so. In this scenario, you should follow the legal framework of the Mental Capacity Act. Also consider the wishes of the patient's family and the advice of colleagues. When consenting patients, good communication is essential. You must assess the patient's needs, wishes, and priorities, as well as their knowledge and understanding. Consider the nature of the condition and the complexity and risk of the treatment or investigation you are consenting the patient for. When communicating this information, you should not make assumptions about information the patients want or need. Instead, you should ask them. Don't assume a patient's level of knowledge and understanding, or what is most important to them. You should explore this to allow you to give the patient the best treatment or investigation options. Patients should be supported to make a decision and allowed time to make decisions. If the exam scenario does not require an immediate decision, it may be beneficial to refer the patient to supplemental information, such as leaflets, or refer to other colleagues. It is your responsibility to maximize the patient's understanding, such as by using an interpreter. It is your responsibility as a doctor to check that the patient understands what you are telling them. You should encourage questions from the patient and answer them honestly. When you are consenting patients for treatments, investigations, or examinations, you must explain the potential risks. These include side effects, complications, or failure to achieve the desired aim. The GMC states that you must discuss all serious adverse outcomes, those likely to cause death or serious harm, however unlikely. Ensure that you balance any discussion about the risks by explaining the benefits of any proposed treatment or investigation. You must support patients to make the best possible decision for For patients who have the appropriate mental capacity, you must respect the decision they make regardless of your opinion on that decision. You can assess the patient's capacity if you are concerned they do not have the mental capacity to make that decision. Patients may give their consent in several ways. This may be implied, such as rolling up their sleeve to allow a blood pressure measurement to be taken, or it may be verbal or written. The GMC state that verbal or implied consent is acceptable in cases of minor or routine investigations or treatment, as long as you are satisfied the patient has an understanding of what you are proposing and the reason why. For all cases of higher risk, you must obtain written consent. This is commonly surgery or other investigations or treatment carrying higher risks. The purpose is to ensure both the doctor and patient are in agreement. In the exam, you may be required to gain consent from a patient for an investigation or treatment. Work in partnership with your patient and make decisions together. Listen to their ideas, concerns, and expectations and share with them the information they want and need in a way they can understand. Support your patient to make a decision and allow them the time to make the best decision for them. It is your responsibility to explain the risks and benefits of treatments and investigations in a balanced way. Ensure the patient has capacity and highlight to the examiner you would document the discussion and patient decisions. The latest GMC guidelines on consent can be found through this link.